Today we're actually going to seat a veneer case. Usually we like to minimal prep, which means we don't reduce the teeth much in size. However, in this particular patient, she had a lot of crowding, so we did have to reduce the teeth a little bit more and decided to do crowns. You might think they look fairly straight. However, you can see the teeth here are recessed back a little bit. These are a little bit bulky. They extend into the teeth on either side of the space, and she wanted her buccal quarter opened and just a more uniform smile. This tooth is shorter than this one, and these teeth need to be placed out a little bit more with a more uniform color. Now let's take a look. We went ahead and prepared her teeth. Now you think, oh, this could be drastic, but she had very large fillings in the back, so we ended up doing crowns. The only two teeth that are veneered are going to be her two front teeth. And you're going to see the results are going to be absolutely outstanding. We did not do anything on the lower, even though she probably could do veneers on the lower, but we're going to go ahead and show you what the upper looks like. First step is we go ahead and we place an etchant over the existing preps, and this is what's going to help with the adhesion of the material. Next, we place a second substance, a liquid that actually helps with the bonding. And then this will be light cured. And light cure the bonding material, and that's going to help the veneer actually bond to the tooth. We have a veneer and we have a crown. I want to show you the difference. So veneer actually only covers the front of the tooth. The back of the tooth, the back of the veneer is open. So you have your natural tooth in the back, and the veneer only covers the front of the tooth. The crown actually covers the front and the back of the tooth. So you have the front of the tooth and the back of the tooth, and it covers the entire tooth, whereas a veneer only covers the front. So this is veneer and this is a crown, same material, and we're going to mix and match on this particular patient. So we have particular shades that we see at the veneers. We've already tried the particular shade for this case, and you can see how we're placing the material into the veneer, and then we're going to place it in the patient's mouth. So we're going ahead and we're placing it in the patient's mouth. We'll go to the next one, and you can already see the difference between her prep tooth and the actual veneer. Now this cement takes a couple of minutes to set, and it usually requires, well, it does require a curing light to set the material. So we'll place the other one next to it. The transformation is about to begin. We're seating 3 veneers, and then the rest are crowns. And we can mix and match, and the color is quite beautiful. Now we did pick a color a little bit lighter than her lower teeth because most people's upper teeth are lighter, and we really don't want to match the color on the bottom. She can whiten, and if not, then she can end up possibly doing veneers on the lower at some point. And if you look at a lot of news anchors, you'll find out that a lot of them had cosmetic work, and their upper teeth are much lighter, and their veneers and their lower teeth are usually their natural teeth. This is an implant. So we've actually incorporated an implant into our smile as well. And the implant fits perfectly. So we have an implant, we have veneers, we've got crowns, we've mixed and matched everything, and you can see the transformation beginning. Turn to the left, please. And this patient is awesome for letting us do this. Thank you. You can see how these are going in just beautifully. There's her front teeth. Pretty magical, I would say. Back teeth are crowns. So that's because she had big fillings and crowns in the back to begin with, so we're replacing. And we've already tried the color in before we seated these today, so we tried them in earlier. It's absolutely perfect. Sometimes patients' mouths are kind of small. And if you got big hands, well, Shaquille O'Neal, that's probably why he's not a dentist. LeBron James, none of them will be dentists. Can you imagine having those big hands in your mouth? They would be pretty tough. And my hands aren't that small. Okay, we're going to finish seating these, and then we're going to light cure them, then we're going to come back and show you the results. So we finished her case, and it's gorgeous. Bite down. This is her finished result. These 2 are veneers. This is an implant, a veneer, and the rest are crown. And it's absolutely gorgeous. Bite down. This is a final result of a veneer case where we actually mix and match veneers, crowns, and implants. We learned about minimal prep veneers versus actually prepping. We had to prepare hers because of the crowding and the nature of her teeth. Great result. I'm Dr. Terri Alani, the Texas Tooth Lady, and please subscribe to our channel. Thank you so much.